Hi, I'm Rich Daly, and this is Fast Finance, your quick hit of the news and numbers that matter in healthcare finance. Up first, weird numbers. These are some random healthcare numbers that recently caught our eye. Today's weird number is 40%. That's the increase in bad debt and charity care per calendar day when comparing year-to-date 2023 to year-to-date 2026. That finding is from the latest Kaufman Hall Hospital Flash Report, which uses Strata decision technology data from 1,300 hospitals. Now for today's main story. Hospitals derive only about 1/3 of their revenue from patient care, as low public payer rates and other factors have driven them to find other income sources. That's according to a new analysis. Net patient revenue was a median of 29.9% of gross revenue across non-federal short-term acute care hospitals in 2024. That was a finding from Trilliant Health, a consulting firm for health systems, payers, and drug manufacturers.
Only about a third of their revenue on average is from directly providing patient care, the thing that we think of them as being designed to do on a day-to-day basis. So we found that to be pretty staggering.
That was Allison Oakes, Vice President and Chief Research Officer at Trilliant Health and an author of the analysis. Net patient revenue as a percentage of gross revenue ranged from 8.3% to 86.6% across hospitals. It averaged 34%, and variation by hospital type included net patient revenue averaging 28.8% for for-profit hospitals and 49.3% for faith-based nonprofit health systems. The finding identifies a key support that allows hospitals reporting negative operating margins, such as the 39% with negative operating margins in 2023, to continue operations. Oakes said hospitals are forced to generate such large shares of revenue from non-patient care due to a combination of factors. Those include underpayments from Medicare and Medicaid, or inefficient management driving administrative costs, as well as location-driven costs. Although this study did not delve into the types of non-patient care revenue, those can include market investments, state and federal grants, philanthropy, state assistance, or real estate income, according to Oakes. Non-patient care revenue sources that have taken on larger roles in recent years include medical device sales, pharmacy operations, infusion services, and a 340B drug discount program.
I think the big question for us to sort of assess as health economy stakeholders, but also as a society more broadly, is what do we think it means that hospitals generate so much revenue from non-patient related activities? Do we think that's something that makes sense? Do we think that's something that should continue? Or do we think that we should reconsider our reimbursement structure?
The analysis also identified the median share of various components of total operating expenses. Those include direct patient care labor at 23.9%, non-patient care labor at 12.6%, and drug costs at 6.1%.
Direct patient care labor is where hospitals are spending the largest sort of proportion of their funds. That said, in the scheme of 100%, only a quarter going to direct patient care labor in some senses might seem a little bit low.
Since many hospitals are generating the majority of their revenue from non-patient care sources, factors outside of payer dynamics can have outsized effects on their finances. Many hospitals have created large investment portfolios that could face big losses in any significant market downturn.
Given the fact that so many hospitals across the country are generating potentially the majority of their revenue from non-patient care sources, things like financial market conditions can certainly influence the financial stability of hospitals. and especially those with significant investment assets. Again, just because hospitals are sort of exposed in the sense that they aren't able to generate large enough margins from direct patient care specifically, and they have to diversify in these ways, they are open to sort of exposure in the open market in the same way that other companies or individuals are as well.
That means the current market downturn bears close watching for downstream effects on hospital revenue this year. Now, before we go, just one more thing. Proposed changes in the rules of the ACA marketplaces will shift more costs onto hospitals. That's according to industry advocates submitting comments to CMS. The comments from various hospital groups came in response to a proposed rule for 2027 marketplace plans that aim to stabilize enrollment from 2026 to 2027. Several proposals would expand catastrophic plans, access to which is now generally limited to enrollees 30 and younger. Older enrollees could qualify for such lower premium, high deductible plans through a broadened hardship exemption if they don't receive subsidies for premiums or out of pocket costs. Such plans could increase deductibles to as high as $15,500 for individuals and be auto-renewed for as long as 10 years. Among a range of proposed network changes, CMS also proposed to permit no network plans on the marketplaces, and they detailed how such plans could achieve qualified health plan status. Those plans may include ones that use reference-based pricing. Well, that's all we got for today. Don't forget, you can get the Fast Finance newsletter delivered right to your inbox every Wednesday. Sign-up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.